Placenta previa is a condition where the placenta lies low in the uterus and partially or completely covers the cervix. The placenta may separate from the uterine wall as the cervix begins to dilate open during labor. How common is placenta previa? Placenta previa affects about 1 in 200 pregnant women in the third trimester of pregnancy. It is more common in women who have had one or more of the following: more than one child, a caesarean birth, surgery on the uterus, twins or triplets. What are the different types? Complete previa, the cervical opening is completely covered. Partial previa, a portion of the cervix is covered by the placenta. Marginal previa, extends just to the edge of the cervix. What causes placenta previa? The placenta may be located in the lower part of the uterus, either covering or adjacent to the cervical outlet, for a number of reasons. The placenta normally migrates away from the cervical opening as the pregnancy progresses, so women in the earlier stages of pregnancy are more likely to have placenta previa than are women at term. Although up to 6% of women between 10 and 20 weeks gestation will have some evidence of placenta previa on ultrasound examination, 90% of these cases resolve on their own as the pregnancy progresses. Placenta previa that persists beyond the 20th week of gestation can be due to abnormalities of the uterus that promote attachment of the placenta in the lower regions of the uterus, or to factors that require an increased size of the placenta. Uterine factors that can predispose to placenta previa include scarring of the upper lining tissues of the uterus. This can occur because of prior caesarean deliveries, prior instrumentation such as D&C procedures for miscarriages or induced abortions of the uterine cavity, or any type of surgery involving the uterus. Placental factors: when the placenta must grow larger to compensate for decreased function, lowered ability to deliver oxygen and/or nutrients, there is an increased chance of developing placenta previa since the surface area of the placenta will be larger. Examples of situations in which there is need for greater placenta function, and a resultant increase in risk for placenta previa, include multiple gestation, cigarette smoking in the mother, and living at high altitude. Who's at risk? Placenta previa occurs in about 1 out of every 200 pregnancies. You may be more likely to develop it if you smoke cigarettes or use cocaine, are 35 or older, have been pregnant before, have had a C-section before, have had other types of surgery on your uterus, are pregnant with more than one baby. What are the symptoms? It's possible you won't know you have placenta previa until your doctor finds it during a routine ultrasound. The most common sign is bright red bleeding from the vagina during the second half of your pregnancy. It can range from light to heavy, and it's often painless. But some women also have contractions with the bleeding. Diagnosis: placenta previa is diagnosed through ultrasound, either during a routine prenatal appointment or after an episode of vaginal bleeding. Most cases of placenta previa are diagnosed during a second trimester ultrasound exam. Diagnosis might require a combination of abdominal ultrasound and transvaginal ultrasound, which is done with a wand-like device placed inside your vagina. Your healthcare provider will take care with the position of the transducer in your vagina so as not to disrupt the placenta or cause bleeding. If your healthcare provider suspects placenta previa, he or she will avoid routine vaginal exams to reduce the risk of heavy bleeding. You might need additional ultrasounds to check the location of your placenta during your pregnancy to see if placenta previa resolves. Treatment: there is no medical or surgical treatment to cure placenta previa, but there are several options to manage the bleeding caused by placenta previa. Management of the bleeding depends on various factors, including the amount of bleeding, whether the bleeding has stopped, how far along your pregnancy is your health, your baby's health, the position of the placenta and the baby. If placenta previa doesn't resolve during your pregnancy, the goal of treatment is to help you get as close to your due date as possible. Almost all women with unresolved placenta previa require a caesarean delivery. For little or no bleeding, your healthcare provider might recommend rest, which means avoiding activities that can trigger bleeding, such as sex and exercise. Be prepared to seek emergency medical care if you begin to bleed. You'll need to be able to get to the hospital quickly if bleeding resumes or gets heavier. If the placenta is low-lying but doesn't cover the cervix, you might be able to have a vaginal delivery. Your healthcare provider will discuss this option with you. For heavy bleeding requires immediate medical attention at your nearest emergency health facility. Severe bleeding might require a blood transfusion. Your healthcare provider will likely plan a C-section as soon as the baby can be delivered safely, ideally after 36 weeks of pregnancy. However, you might need to have an earlier delivery if heavy bleeding persists or if you have multiple bleeding episodes. If your delivery is planned before 37 weeks, your doctor will offer you corticosteroids to help your baby's lungs develop. For bleeding that won't stop. If your bleeding can't be controlled or your baby is in distress, you'll likely need an emergency C-section, even if the baby is premature. Thank you for watching. Please don't forget to like and subscribe to my channel, and please click on the bell so you'll be updated on my next video. Thank you. WeCare for UPH. Your health comes first.